Hello, and welcome to Cutting Edge Integrative Pain Centers and Cutting Edge Pain Relief. Today, we're going to talk to you about platelet-rich plasma and why color matters. I know you guys have been waiting with bated breath, and we want to make sure that you get your questions answered in depth and detail. So for those of you who follow us, you have probably known we talk about PRP, platelet-rich plasma, and regenerative medicine type techniques in the past, and we've done a number of talks that have really given the layperson insight about how it could be able to potentially work for them. Some of the videos that we've covered before have been things like this, where we've talked about how it works and things along those lines. We've talked about PRP in the context of whether it helps shoulder issues and also what you could be able to utilize platelet-rich plasma for compared to surgery for various different issues and challenges. Right? For those of you who really are looking for a summarized version, let me just say as a quick plug, our own clinic has a manual that is for the layperson so they can understand really what that entails. And that manual looks a little bit something like this, which is the platelet-rich plasma treatments guide. And it basically can be found in the following area at cuttingedgepain.com/Regenix/PRP. So full disclaimer for you right now, just to be quite frank, what we're going to talk about is platelet-rich plasma in general. We're not talking about how it's done at our particular clinic, and we won't give you those details. That you could set up a consultation in the future if something like that interests you. So what we're going to talk about is platelet-rich plasma as a whole. And we really want you to understand exactly what that means. So let's kind of start from the beginning. Before we get into talking about platelet-rich plasma, most people, when they're looking for something, they're going to say, you know what, I'm either going to go to Google or you know what, I'm going to go to YouTube. So in going to YouTube, you'll see a number of different things that look at red PRP versus amber. You'll look at things like platelet-rich plasma talked about by Hopkins and a couple other different major academic centers. You'll maybe even see things like this: how to make PRP at home, do it yourself, and microneedling. That one I wouldn't necessarily suggest for most people. I'm not so sure you really want to try to make your own PRP and inject yourself. What some people will say is, well, you know what, maybe I'll pose a question online and see if it gives me answers. And some of those questions might be things like this. So is it okay to get a PRP injection if it's red? I was told it needed to be yellow and I got injected with dark red. Is this something that's good? And you'll see answers like, well, PRP is typically yellow, but if you got it with red, it just may not have as much of an effect. And quite frankly, to kind of give you the answers to the test ahead of time, it's nuanced. There is an indication predominantly for more of that amber type PRP. But at the end of the day, we want to kind of make sure that you understand this, particularly as a layperson, so you have some semblance of saying, you know what, I understand what I'm getting, why I'm getting this, and how it's going to help me. So we're going to break it down for you, as we always do. So that way you can be able to understand how to be able to get your life back, how to be able to punch pain in the face and get back to doing the things that you want to be able to do. So when we talk about PRP, we really need to kind of start from the very beginning. Right. And in talking about going from the very beginning, thank you for those of you who are joining us live, by the way, we need to talk about blood. So when we talk about blood, what we know is what is the composition of traditional whole blood. So the composition of whole blood is a blend of different things. It's a blend of something that's called plasma. It's a blend of red blood cells, and it's a blend of white blood cells and then platelets. So the platelets themselves are a small amount of what's contained within the blood. As you can see, plasma and red blood cells are the major constituents, or what actually makes blood, right? And so normally that's what we think about. When we think about blood, we think about red blood cells, and they're just moving through the vessels and the veins. And, we're like, oh, okay, it looks something like this, right? We got red blood cells. They're moving, maybe quick, maybe slow. They have these little oxygen carrying areas, and that's really what we're interested in, right? But what we're interested in for this talk are platelets. And platelets are actually more complex than what we might think. So platelets themselves come from a type of cell that breaks down and functions to be able to have these little portions that really are not cellular in nature. but they cause and do different things, most notably of which, as we kind of think about when they're activated, is that they can cause healing, particularly of wounds and stopping bleeding. And so traditionally, when we look at that platelet type function, when we think about it from an anesthesia standpoint or surgery, you can have something that's called pool platelets, which look like this. And so those pool platelets are put into a bag, much how you would kind of save the same things for like red blood cells. And you can see that there can be distributed at a latter portion in time. But that's not what PRP is. PRP, or platelet-rich plasma, actually has a whole host of different constituents that are incredibly important that matter whether it works for you or not, and there are different ways to prepare PRP. So let me kind of give you a quick overview first, then we're going to explain how PRP is made, and then we're going to talk about the different types and why those things might matter to you. So quick overview of PRP is there are different variables that affect it, right? And so some of the things that affect it can be things like age, sex, height, diet, blood pressure, different stressors, what's the status of that person, and whether they're taking different types of drugs and such. PRP, in terms of how it's prepared, can be highly variable in terms of what your red blood cell count is, what your platelet count is, what your leukocyte, what your white blood cell count is, whether the platelets are activated, whether you use a certain type of anticoagulant, how it's prepared versus gravitational versus centrifuge in order to be able to separate out the different components of the blood that we may mention before, how fast that centrifuge is, what's the time frame it's used for, the type, and really whether there's differences in terms of how many different steps are put into play. So I know that seems pretty involved, and it is. And that's one of the reasons why we're going to kind of give you some further insight about what does that mean and how can I be able to get further understanding. So first and foremost, we want to kind of give you an agnostic, meaning it's not our way or the way. So we want to give you resources that you can look at and that you can say, okay, I got a paper. I can be able to take a look at this. It's free, it's downloadable, and it's not necessarily coming from one clinic, meaning that it's their way. So one of the papers to potentially be able to utilize is the following. So you can find this online if you Google it in there, or you go to PubMed or either of the two. You can find it's a little bit dated from 2014, but it talks about methodology or how you prepare platelet-rich plasma in one way to be able to do this, right? So when you look at it, the way that it talks about is the following. So first, you get the blood from the person doing a venipuncture. You get a collection of tubes. Here it talks about 34 milliliters, and there's about 8.5. So there's a number of different tubes that are involved of whole blood. And then after that, what you do is you do that spin that we alluded to earlier with the centrifuge, and you can see how it separates out into the plasma and then components of the cell. And then you transfer a portion of that into these empty sterile tubes. Right. So that's the first part. But then after that, you have a second part where you take that component and you do another centrifuge or spin. And then with that centrifuge or spin, you can see that there's a collection of platelets that's present at the bottom. So this is kind of the secret sauce. And that collection of platelets is what you're going to then utilize to have it be concentrated. So normally when we talk about platelet-rich plasma, there have been a couple of studies, like I want to say there's a reference from a JAMA study, JAMA, that talks about PRP not being affected. And that study has really been debunked by those people that are in the know because they didn't really concentrate the platelets. They took the platelets and they tried to inject it, and it was the same area or amount that you would have within your normal blood. In order for you to get PRP, you really have to take those platelets and concentrate them above the amount that you would normally receive. So that way you can get the effect of what we're going to talk about in a little bit, which is how those platelets work in order to be able to make things happen, right? But at the end of the day, when what you end up doing is you get in this platelet plug, and then you take off a fair amount of the plasma, and then you leave just a little bit, which results in a concentrated platelet-rich plasma. So that's kind of the summarized version. And I know that was probably a lot, but hang with me. And if you have questions and you're joining us live, by all means, please ask questions as you see fit. So what can happen in terms of the different types of PRP are the following. So you can have pure platelet-rich plasma, which is traditionally leukocyte poor. You can have leukocyte and platelet-rich plasma, which contains leukocytes but low-density fibrin. You can have pure platelet-rich fibrin, which is traditionally without leukocytes, but it has a high-density fibrin. Or you can have leukocyte and platelet-rich fibrin PRF, and that contains both leukocytes and high-density fibrin. So right off the bat, people are like, well, what the heck is PRF? So if we're to take a look at that, this is traditionally PRP and this is PRF. And you can see that there's a difference in terms of where the majority of growth factors are localized to in regards to the cells versus not. And then you can also see that there's a difference in terms of how it's generated. So PRF uses a low G force and PRP uses a high G force. But be that as it may, that doesn't necessarily mean that one is better than the other. So let's talk a little bit more about PRP and how it has differentiation. So first of which, you can differentiate it based off of the concentration and how much greater it is compared to what the normal platelets are present in the blood. We talk about how it's activated, meaning there are different outside chemicals or exogenous areas that make those platelets activate and do the things that they do. And they can talk about then whether you had white blood cells present or not. But without boring you to death, what most people want to know is how is it going to be effective for them? And should they pick one type versus the other? And so that's what we're going to talk about in the next few screens. And what you'll see is that there are differences. So there was a study that looked at a pooled data or analysis of different studies that have evaluated this. And so one of the things they looked at was what was the indication and how it potentially impacted it. So osteoarthritis is where you have that component of arthritis that's due to sort of that component of wear and tear that can cause you to have some degree of pain. And what they saw was a breakdown between that PRP, which has kind of that constituent of not really having a lot of leukocytes or white blood cells, and then those that were leukocyte rich. And what they saw in this one particular study is they saw improved symptoms that were present with the context of traditional PRP without having leukocytes. And then the other study looked at PRP and saw that there was less severe osteoarthritis when you had traditional PRP type treatments as opposed to leukocyte rich environments. Then they also looked at another indication, which was lateral epicondylitis. And so put in regular layman's terms, meaning problems with the outside portion of the elbow. So what they saw was there was an improvement in patients when they compared it to corticosteroids or traditional cortisone. But what they were really able to see in these particular studies looked at a blend of leukocyte rich and then a mixture of PRP that did not have a labeling aspect. So we don't know if it was leukocyte poor or components of fibrin. Other indications were those like Achilles tendinopathy, so meaning a problem where the tendon in and around your heel and how it was compared to different types of placebo. And so this particular element looked at traditionally leukocyte rich, and they didn't see where there was a huge improvement compared to placebo. And then they also looked at patella tendinopathy. And for this, they saw statistically significant improvement that was present with PRP compared to other types of treatment. And in that construct, it was leukocyte rich. So we're seeing this variable nature if you haven't picked up on that. So let's talk about other indications that are in place. So rotator cuff, so shoulder type pathology, right? So what this was, it looked at studies that looked at PRP and saline, and what they saw was there's no difference when you had a leukocyte rich preparation. And then over here, they saw significant functional improvement and symptomatic relief that was present with an unknown component that wasn't labeled as either leukocyte poor or leukocyte rich. Then they looked at augmentation of both rotator cuff as well as ACL. And what they saw in some studies is that was less pain that was associated with leukocyte rich. They saw that there was a 20% reduction in re-rupture and improvement in those that were leukocyte poor. They saw that there was improvement in terms of different ACL graphs when you use traditional PRP or leukocyte poor. And they saw for SI joint, they saw that there was a statistical significant difference when you used leukocyte poor for SI joint instability. So what's the upside to this? Because this, it's going all over the place. Well, this is what they found in this particular paper for conclusions, is that different types and applications with the literature, that they believed that leukocyte rich appears to be more effective in chronic tendinopathies. However, this they postulated was due to first stage of tendon healing, including inflammation from leukocytes and catabolic cytokines. In contrast, PRP that were leukocyte poor seemed to be great for cartilage pathology. And this may be because leukocyte rich, has been shown to cause a significant inflammatory response and probable synovial cell death, meaning it's causing issues with cartilage production. At the end of the day, there have been a number of studies that have looked at both, whether it's leukocyte rich versus leukocyte poor. Traditionally, leukocyte rich causes this inflammatory response, which can cause swelling of the joint and typically some degree of pain when you initially inject with PRP that has a fair amount of leukocytes. And the value that has may be present and it may not, depending upon how well the patient tolerates it. Going on, let's talk a little bit more. And so one of the things that we really want to kind of identify is, so how does all this work? Is it just the platelets themselves and they come there and they maybe do some changes to the area? Well, actually, it's more complex than that, as I'm sure you probably gathered. So there's various different products and elements, and specifically growth factors, that are present when you inject PRP. So you have different factors like PDGF, which is platelet-derived growth factor. You have TGF beta. You have vascular endothelial growth factor. You have epidermal, insulin, and fibroblastic growth factors. And these things can do everything from collagen synthesis to improvement in angiogenesis, which is the construct of different blood vessels and such. It can be able to increase cell proliferation. It can be able to improve what's going on from a cytokine standpoint. It can cause cell growth, differentiation, and changes in both chondrocytes and osteoblasts. And so those are the cells that deal with both cartilage as well as bone formation. Sometimes you may want that, sometimes you may not. But that's what we're getting when we have all these different factors that are present within PRP. So those things are going to not just be growth factors alone, which you can see as that row number 2, but you have other things like chemokines and clotting factors and integral membrane proteins and immune mediators, all of which are important in the healing cascade. So going back to this again, one of the things that we see is we see this construct of different types of PRP formulations. So you can have pure platelet rich that is leukocyte low. You can have platelet rich with leukocytes, which are white blood cells again. You can have platelet rich fibrin, which does not have white blood cells. You can have leukocyte with fibrin. And you can see how all of this potentially gives benefit and can be able to improve it depending upon what your condition happens to be. So whether it's tendinopathies, whether it's osteoarthritis or arthritis with cartilage, at the end of the day, the thing that you really want to know is, does your physician have the ability to potentially be able to alter what is present when they deliver it? Some do, depending on the type of system or methodology that they have, and some don't. And what you want to know is, for your particular condition, do you have multiple different indications? For instance, you might have cartilage loss and a tendon issue that can be addressed based off of the way that physician or provider is able to give you a treatment accordingly. So again, want to kind of circle back to what we might be able to provide to you. For us, if you really want a summarization of this, if you go to our manual, that's called a Platelet-Rich Plasma Treatments Guide, you can be able to see a summary of what is explanation of PRP and how it has value. And then if you take a look, if you find it on this website, you can be able to see our website, cuttingedgepain.com, and Regenexx PRP, give you a way to be able to take a look and really evaluate this in depth and detail. Again, we want to make sure that patients have an understanding about how you can be able to treat your problem, your pain, and improve your function, and that you understand it broken down in layman's terms of how this provides value to you and why you would want to pick one option versus the other. Again, I'm Dr. Orlando Landrum, giving you insight into different treatments for being able to improve your pain, be able to improve your function, and how to be able to punch pain in the face and get back to living the life that you deserve. Thank you so much and have a great day.